Good afternoon, everybody. I'm Dr. Linda Silver. I'm the Eugene McDermott Chief Executive Officer here at the Perot Museum of Nature and Science, and I want to thank you all for joining us for today's Science Spotlight. When the Perot Museum opened in late 2012, we made a commitment to serve as a science communications hub, and we pledged to be both a disseminator of scientific information and to serve as a source of scientific fact within our community. In recent weeks, the need for this role has grown even greater as our country and indeed our world faces the pandemic we now know as COVID-19. We are witnessing a situation that is changing daily, if not hourly. It's causing uncertainty and anxiety, and it's raising a lot of questions. So who better to address those questions than the health and science experts in North Texas who are battling COVID-19 on the front lines? We are thankful and honored to have with us today a team of notable experts representing numerous local agencies from throughout North Texas. And speaking of experts, we are delighted to have with us Saida Hassan, the mental health reporter at KERA and lead reporter with the series On Our Minds, to moderate our panel. I'm now going to turn this over to Saida to give an overview of the program and to introduce our panelists. So, Saida.
Thank you, Linda, for the introduction, and thank you to the Perot Museum for hosting this important and timely discussion. The coronavirus pandemic is evolving rapidly and is affecting the daily lives of people around the globe. In recent days, we've seen President Trump issue a national emergency. Local jurisdictions, including Dallas County, have banned large gatherings to try and flatten the pandemic's curve. Today, we've gathered a panel of experts to help us understand this new disease called COVID-19. Each of our speakers has prepared some remarks, and after each of their presentations, we'll have an opportunity for questions. To the media joining us, you'll have an opportunity to visit with our speakers for individual interviews after the panel concludes, if you haven't already done so. As mentioned, this discussion is being live streamed on the Perot Museum's YouTube page, and that is at youtube.com/Perot Museum. It will also be posted to the museum's Facebook, Twitter, and Instagram pages, so please follow along and send in your questions for our panel of experts via social media, and we'll have a chance to get those questions answered throughout today's presentation. I'd now like to introduce our panelists. First off, we have Dr. Philip Wong, who is Director and Health Authority for the Dallas County Health and Human Services Department, a role he's held since February of 2019. Prior to coming to Dallas, Dr. Wong served for 11 years as Medical Director and Health Authority for the Austin Public Health Department. Dr. Wong has also served as the State Chronic Disease Director at the Texas Department of State Health Services. Mr. Stephen Love is President and Chief Executive Officer of the Dallas-Fort Worth Hospital Council. Mr. Love has worked in healthcare management for over 40 years. Prior to joining the Hospital Council, he was Senior Vice President and Chief Financial Officer of a Fortune 500 healthcare company. Dr. John Carlo is Chief Executive Officer for Prism Health North Texas, which is the largest community-based HIV/AIDS service organization in North Texas. Prior to this, Dr. Carlo served as Medical Director for Dallas County Health and Human Services, and he was the lead official during a number of public health emergencies, including the 2009 H1N1 pandemic, several West Nile virus outbreaks, and 4 large-scale hurricane shelter responses. Dr. Carlo is also a past president of the Dallas County Medical Society. Last but not least, Jennifer Finley is Director of Health Services at the Dallas Independent School District. It's the second largest public school district in Texas and the 14th largest district in the nation. She has 15 years of extensive experience leading clinical operations, nursing development, professional development, and directing district school health programs, and she does all this with an emphasis on safety, health, and prevention. So Dr. Wong will have to leave us a little bit early today, so we'll begin with his presentation. Take it away, Dr. Wong.
Sure, thank you. Well, it's an honor being here. I think as you've heard and have been following in the news, this has been changing and evolving daily. I think now globally there's over 100,000 cases, and it's started in China and it's moved to multiple countries. And so I'll start out just talking a little about locally, because our current case count of presumptively positive COVID-19 cases in Dallas County is we've had 14 positives, although 3 of those were actually out-of-county residents. So if you look at our webpage, it's now officially down to 11. But thus far, and we've been talking about this for weeks, we've really been in a containment mode. So early on, we've been monitoring travelers who are coming from China. We have our staff that check on them to see if they have any fever, develop any symptoms during a 14-day self-isolation, self-quarantine period that the people were undergoing. And monitoring, and if anyone developed any symptoms, we'd arrange for the testing. We've been working with our healthcare providers on getting the latest CDC guidelines for testing. All of this, in coordination with the state health department, with the federal CDC and others, and community partners. And while we can do that and stay in that containment mode, we'll be able to do that for a while. But we've been saying we anticipate there will be more cases. Even when we had no cases, we were doing this monitoring, and we said we anticipate we'll see cases, and that's what we're starting to see. Last week, then we had our first case that was not just travel-related, but indicated community spread. And so as we're doing the containment mode, we've also been planning for more of a mitigation sort of effort. Because if it becomes so widespread in a community that you can no longer follow up on each case and identify contacts and do contact investigations and follow up on them and get them isolated and quarantined, then it becomes, what are the efforts that trying to prevent this further and slow down the spread of the COVID-19? And the slowing that spread down really has 2 major goals: to protect the vulnerable populations, and those vulnerable populations are persons over 60, those with chronic health care conditions. That's where we've really seen the severe illness. And the other purpose of slowing down this spread is to really protect some of the healthcare system. We've been watching how this progresses in other countries. We've been watching what's been going on the West Coast. And so this is why, again, it's been evolving. We've been all learning, what is working in some communities, what is not working, and trying to learn from those experiences. So as we're going forward, we're moving into this mitigation phase. That's where, when we've had our first evidence of community spread, then what's been seen and learned is that we really need to take action quickly to prevent and slow down that spread, to protect the vulnerable populations, to protect our healthcare systems. Because again, we've seen in some of these other countries how the numbers can get so overwhelming for the hospitals and healthcare providers. And so that's the goal of this, is to really slow it down, sort of draw out the number of cases and illness that we see so it doesn't overwhelm the healthcare system. And simultaneously also, there are efforts to try to develop and identify effective treatments. We've seen and heard that probably a vaccine's a year to a year and a half away. But that's sort of the strategy of what we're doing. But it does take all of us to make this slowdown effective. And that's where we've also been, in the meantime, working with our community partners, with first responders, with the schools, with the universities, with the businesses, with all these different sectors, with the long-term care providers, with the homeless shelters, to make sure that they know the latest guidance and recommendations that are out there from CDC, and to work with them to implement some of these preventive measures. And we've also been trying to get the message out of the importance of the personal protective measures. You cannot overemphasize the importance of washing your hands. Don't touch your eyes, nose, and mouth. Cough or sneeze into your arm or into a Kleenex and throw it away. Stay home if you're sick. Wash regularly those surfaces that are frequently touched. Stay away from people who are sick. Those are, these basic personal preventive messages that are so important also for preventing the spread of this. The other thing, just want to emphasize, these vulnerable populations, persons over 60, persons with chronic underlying conditions, really that's the population where the severe illness is seen in much higher percentages, and we're really trying to protect those persons. And a lot of the recommendations, really, if you can, stay home if you're in those categories and avoid crowds. And these are some of the important things that we're all going to have to participate in, all have to work on, and collectively slow down the spread of this.
Thank you, Dr. Wong. And I have some questions for you, and I'd also like to encourage our fellow panelists, if you have a point you'd like to chime in on, please do so. So first off, Dr. Wong, you talked about the evidence of community spread that we've now seen of COVID-19 in Dallas County. How does this change the nature of the immediate risk to residents, and what types of steps should people take in their everyday lives to try and prevent further spread?
So this is where, so the evidence of community spread means it's not just people who have come from these areas where we know there's other community spread that brought it into, that there is person-to-person transmission going on among people who haven't traveled anywhere. And that's where, we kick into that next phase of really trying to implement these social distancing practices, these mitigation efforts. And so we've, again, been trying to get that message out for several weeks. Don't panic, but still be thinking really in a detailed way. What are you going to do if the schools close? What are you going to do about your child care? What are you as a business planning and plan, in terms of leave policies so that people who are sick can stay home? They're not, there's not discouraged from staying home, that those leave policies support that the teleworking opportunities to stay home and still be working, working out those things. I know the schools have been working on sort of learning methods. So that's what we've been talking about for the last couple of weeks. That's where now we are actually implementing, and we're seeing those. And then the Judge Jenkins, issued the order last Thursday to really limit, requirement, no gatherings more than 500, with strong recommendations, no gatherings of 250 or more, and for vulnerable persons in those high-risk categories that I've mentioned, really not to be in groups of 10 or more.
Right. Folks across the world really have been introduced to a lot of new vocabulary around this pandemic, social distancing, community spread. Tell us why it's important for people who may feel perfectly healthy to take these steps and avoid large crowds and large public gatherings.
Right. And so it's out, that about 80% of persons who get infected actually have mild illness. 15% have more severe, and then 5% have critical illness. But it's in those vulnerable populations, it gets up to 15% mortality rate in persons 80 years or older. And so even if you're not in those high-risk group, as a community, if you might be younger and have young kids, but you also have your grandparents and other persons that are interactive, that then if you spread that to those populations, it has severe consequences. We've seen how the dramatic sort of seen in the long-term care facility in Seattle, the number of deaths and something. This is what we're trying to prevent, and it requires everyone, all of the populations, even those not in the highest risk categories, to limit and practice those social distancing practices to keep the spread from getting to all the population, and because the vulnerable population would be affected.
Could you walk us through the difference between social distancing, self-isolation, and quarantine, the different measures that are being taken? Sure.
So quarantine, and people get it confused a little bit. Quarantine is actually for people to be separated, for persons who have been exposed to a disease but don't actually have the disease, but that they're at risk of developing it, so to stay quarantined during a period like the period of incubation. So they're not actually sick yet, but they have been exposed. Persons who actually have illness, then are isolated and undergo isolation, and that's to isolate people who have illness. And then the social distancing is the practices of trying to keep, close contact is defined as someone who has been within 6 feet for a prolonged period of time. So it's trying to keep those distances, that 6-foot distance, keep from being exposed to the droplet spread from coughing and sneezing, those sorts of things. And then the policies like prohibiting gatherings, shutting down these gatherings and things like that.
Now, here's a question that's been posed from some folks in the community. If I test positive and live with my family, what do I do?
So if you tested positive, I mean, ideally, okay, it depends if they've been quarantined and were in in that quarantine situation, and then during monitoring identified symptoms, were tested positive. If they were with the family then during that period and then they tested positive, then those family members would be considered having close contact because they would have been, and family members exposed to a positive person are considered having close contact. Those family members would then be asked to be quarantined, monitored for symptoms for that 14-day period, and then tested as needed.
And when it comes to testing, can you walk us through the process in terms of at what stage do you determine that someone is free and clear? How many times is someone tested over the course of that period to determine that they no longer have the disease or that they are not infected?
So persons who have been confirmed to have the disease, to be cleared and say they no longer can transmit it to others, have to have two negative test results separated by 24-hour period. That's the current recommendations for clearing someone who has been positive and then saying you're cured, you can now go back out.
Well, Dr. Wong, I think you and all of our panelists really have been working to get these messages out there to the community. And we have seen measures like the ban on large gatherings over a certain size being implemented. And yet, in many places out in the public, you still see, crowded lines at the grocery store, people congregating, sometimes out of necessity in certain places. And so, how effective has this messaging been? I guess, how do you get folks to buy in and really adopt these changes in their behavior?
It's a difficult situation. This is why it is incumbent on all of us to make this successful. I think we don't have the same governmental edicts that can be made in the same way as some countries, perhaps like China did. But that's where within our systems to be able to implement the social distancing in effective ways. But this is where, as we all understand what that social distancing is, to understand it's that, keeping away from that 6-foot separation, not being exposed to persons who are coughing and sneezing and those sorts of things, people who are sick staying home. We have to, as a community, recognize it's important for all of us to do this to protect our community. But there are then the policies, the orders, things that also can make that official.
And a question I'd like to open up to our panel. We've all seen in recent weeks, especially over this past weekend, folks heading to the grocery store, stocking up on certain supplies. And we've heard public officials like Governor Greg Abbott say that there's no need to do that folks will be able to go out and replenish groceries and supplies as this outbreak evolves. What do you say to folks who feel the need? And what do you think drives that impulse that so many of us have to prepare? Dr. Carlo?
Well, I do think that there's a psychological aspect to this that, once we realize that something might come into short supply, even if toilet paper is what that is, suddenly that becomes something that's very necessary, and everybody sort of takes a step back and realizes, well, how much toilet paper do I have in my house, and maybe I need more. I think that the way I would look at this, and the way I think we're talking about, is we really have to be practical in these situations. I, for example, do not keep a lot of groceries at my house. And so I've bought some more food just in case, some food does not become available for a few days. So just practical guidance at this point. I do think that when we look at social distancing and what we're going to have to be doing for really an extended period, you have to be realistic. And going through this, we know we're going to be in public settings. You just simply can't avoid the opportunities. You're going to have to go to the grocery store at some point and those kinds of things. But the good news is we can still be very protective even in those situations, such as hand washing, making a good amount of distance when you can. When you return from those settings, go wash your hands. Things like that can be done. We know how to protect ourselves from influenza and other colds and flu seasons that happen every year. So we have a lot of good ways that we know how to avoid getting sick, and we just need to continue to use those things.
Syed, Dr. Carlo and I were talking, with social media, there are good things. With social media, sometimes rumors get out there, and he and I were chatting about Hurricane Harvey. And the word got out there was a shortage of gas. And there really wasn't, but everyone went and got gas. So it was a self-fulfilling prophecy. They had to wait for more transport of gas to come in. So I think everyone just needs to strive to be calm.
Thank you. And Dr. Wong, we know you need to head out. Any final remarks before we let you go?
Again, it's not a time to panic. It's a time to continue these social distancing practices, really, all the things that have been said, and together we will, address this.
Thank you. Thank you for your time. Our next presenter is Mr. Stephen Love. I'll let you take it from there.
Thank you, and I really want to thank the Perot Museum. I think this is a very good educational session. And I'm going to speak a little bit from the hospital perspective. Here in North Texas, we represent 90 hospitals throughout the Metroplex, not just in Dallas County. And so we really agree totally with what Dr. Wong said. It takes a village. We've all got to work together. Here are some things that I know people have thought about and asked about related to hospitals. First and foremost, we're here to serve you. We are prepared. We're ready to deal with this virus. One of the good things about this virus, many people don't have to be hospitalized, even if they're presumptive positive. They can be treated at home, which is good. Hospitals also do and want to help the community practice good prevention. And I won't go back over what Dr. Wong went over, but let me say this. Hospitals have a plan. We've worked with all the county health departments, not just here in Dallas County, but obviously there are cases in Collin County, Tarrant County, and we may have more cases. But we're going to work with those health officials. We're going to work with the community organizations. So here are some of the things people have asked me over the past few days and the last week. One, do we have one hospital designated that's going to treat patients? And the answer is no. And the reason is, as you can see, we've had cases, Collin County, Tarrant County, Dallas County. Every hospital is prepared, and every hospital has a control group. They have, for lack of a better term, kind of a master control within their hospital or system to deal with this if we have a case that they have to treat. Secondly, do we have enough personal protective equipment? And that's a very good question, because one of the first things we have to do is obviously protect patients, but also our workforce. And our workforce needs to be protected as we continue to treat patients. We do have enough personal protective equipment. We're very blessed here in North Texas that even though I mentioned we have 90 hospitals at the Hospital Council, many of these hospitals are part of large systems like Medical City, Baylor Scott & White, Texas Health Resources, Methodist, of course Parkland, JPS, our children's hospitals, and they have good supply managers and material managers. And I've talked to many of them, And when this virus began to spread in late December and early January in China, they started adding to the PPE just in case it did become pandemic. So we do have enough PPE, and we're going to work through that. What are hospitals doing to help prevent the spread of COVID-19? Many this past weekend and tomorrow morning are going to implement visitation restrictions and guidelines, and many are going to have things related to the volunteers that work, and they're going to look at points of entry into their facilities. Now, first and foremost, hospitals want to accommodate families, patients, and friends of people that are patients. However, with the COVID-19, we are going to consolidate in many of our hospitals and hospital systems different points of entry so we can control the flow of patients and visitors. At many of those locations, when the visitors come in, they are going to be questioned. Things such as, are you running a fever? Do you have a persistent cough? Are you having respiratory problems? Have you traveled to any of the nations that they will list that are on the level 2 and level 3 and other suspect nations that have had outbreaks of COVID-19? And then they're also going to ask you, in some cases, have you had your flu shot? And if you don't have good answers to those questions, or you've been exposed to someone who has tested positive, you will not be allowed to visit in the hospital. The other thing that they're going to do is put an age restriction. Most are around the age of 16. Some are actually 18, where if you are younger than that age, you will not be able to visit in the hospital unless there are specific one-on-one exceptions that will be coordinated through that specific hospital. The other thing that I think is very important that you'll know is the number of visitors will be obviously, I won't say restricted, but curtailed in the near future. And we're going to ask people that do visit to wash their hands and use hand sanitizer before they enter the patient's room and when they leave. Other things that we've done, just so you know, to help in this, going back to the PPE, is we're looking at how we use it. A lot of PPE has been used by students, have been used by residents in the normal business. Many of those types of activities related to students and residents are being curtailed so we can preserve that PPE. Another thing that we really want to emphasize to people is please don't panic, and does everybody need a test? And the answer is no. The medical professionals and the people that will treat you are going to make the determination if you need a test. First and foremost, if you are running a fever and if you do feel that you're having these symptoms, and it could even be the flu, you need to go to your primary care provider first. Please don't come to the emergency room and just walk in and say, I need a test for this, because that's not going to happen. We want to make sure that we use the test kits appropriately, and we're going to leave that to the discretion of the medical professionals that will be examining you. The good thing about test sites, we do have some private labs, such as LabCorp and Quest, that are going to expand the number of test sites. Another thing that's extremely useful, and I actually went online and checked these out to make sure they're up and running before we came to the Perot Museum today. Many of our health systems have got excellent virtual screening tools where you can go in, go through a series of questions, and it helps guide and direct you, in many cases, to give you peace of mind that you probably don't even need a test. But it's to help educate you and help you screen and see where you are, because many times you may simply have the flu. The other thing that I think is extremely important, and a messaging that hospitals want to get out, And Saida, this kind of touches on what your specialty is. That's the anxiety and the panic that's associated with this. We've been through Legionnaire's disease. We've been through SARS, MERS, H1N1. In Dallas, we went through Ebola. That's not to say in any way that this isn't very serious. It is. It's extremely serious. But if we panic, it's not going to help the situation. So as Dr. Wong said, it truly takes a village, all of us working together, all of us doing our part to help prevent the spread of this is going to be the best interests of the community. Thank you.
Thank you for sharing your insights. I want to get to a couple of questions from social media. Lily on YouTube asks, can sweat be considered an infectious liquid? Dr. Carlo, maybe you can help us out with this one.
So, I think it's important to start with what is infectious first. So to know what we know in terms of coronavirus, right? So what really is infection is first around the coughs and the sneezes, the liquid and respiratory droplets that come out of your mouth and nose when you cough and sneeze. That's why it's really, really important, even during the allergy season right now, to cover your mouth and nose when you cough and sneeze. And so we definitely know those are the most common materials or substances that are infectious. What about sweat? Well, sweat by itself is probably not something that would transmit coronavirus, but again, we don't know if that sweat is mixed with respiratory secretions or other things. So again, it's a good idea to maintain general precautions, really focus on the respiratory droplets, which we do know are infectious, but also be aware of your surroundings.
We'll take one more social media question before we move on. Beckett asks, why are kids less likely to be affected compared to a grandparent?
Great question. I don't think we know the answer to that right now. The one thing that I would say is there's definitely examples of other infectious diseases that have very similar characteristics. Chickenpox is a great example, where we do know that if you are younger, your symptoms would be less severe than if you're older when you come down with the infection. But we really don't know why that is necessarily. There's certainly some theories that you can go and look, but I think at this point it's still too early to tell why that's the case.
Well, lots of medical questions coming in, so it's fitting we move on to Dr. Carlo's presentation.
Well, thank you, and thank you for the opportunity to be here, and thanks to the Perot Museum for hosting this forum, and it's a great honor to be among this great group of colleagues who are up here. I first want to start, why am I carrying a tennis ball in my hand? And I know that I'm a little nervous up here, and I have a tendency to touch my own mouth and face when I'm nervous. So I'm using this as a tool to keep my individual protection measures down. And I think this is the way we think about things. There are some practical things you can do now in order to make sure that you're staying safe. And again, it's the hand washing and doing the general things that we can do that we know that it works. I want to start by just talking about how remarkable we are today with the coronavirus and what we know so far. The cases started emerging not too long ago, just late December. It's hard to believe how quickly things have moved, right? But one of the things I'd also say is remarkable is that within 5 days of getting the test isolated, they actually had the full genetic sequence of the virus. And we actually had a mechanism to test for coronavirus. And I know this is a science program and we're in a museum to talk about the value of science. It is absolutely remarkable if you think about how quickly we were able to do such a thing. Considering in our past not too long ago, it took years for us to find out what these pathogens were. So we've moved really, really quickly. But I do want to talk about that test that is about coronavirus, because that's certainly something that we're hearing a lot of information about. So the test actually is exquisitely sensitive for picking up the genetic material of the coronavirus itself. And that's a remarkable thing that we're able to do. It's new technology. It's only been around for a couple of decades. But there are some limitations, and science is far from perfect. And in this situation, we really have to ask ourselves, does the detection of the genetic material get the information we want or that we need? So if somebody shows signs and symptoms for coronavirus and we test it and find the genetic material, that would confirm that that's the infectious agent. And we think that's a good example. But some other questions come up. You know, can we use the test to predict who might come down with severe signs and symptoms? Or can we use the test to predict whether somebody's infectious? And this is a far from imperfect science in this situation. What about using the test to clear somebody to make sure they're no longer infectious? As we know, there's a protocol that would look for 2 tests in a row over 24 hours. But again, this is an imperfect science. And you know, everything that we do around medicine and healthcare always is this way. And so while we're worried about the test and the availability of the test itself, we know a lot about what the limitations of the science has for us right now around the testing. And again, it goes back to what we do know about infectious diseases, and that we're really looking at the signs and symptoms as a primary focus. What about social distancing? And you know, as we've talked about this, does the closing of mass gatherings, the closing of schools, everything around you know, limiting the amount of people that we're in contact with, does this work? Is this going to work inevitably for preventing transmission? Well, in 1918, we had the greatest influenza pandemic in our history. Over 500,000 Americans suffered and died during that time. And a number of cities used social distancing measures at that time because at that point there was no vaccine and there was no treatment. In fact, there was not even antibiotics back then. And what they found through history is that the cities in 1918 that implemented the social distancing measures earlier, to a greater degree, and longer actually affected the overall mortality. So we know it works, but we also know the degree that's required in order to get that done. It has to be done early, it has to be layered with multiple different methods, and it has to stay the course. And one of the things I worry about is this is a little different from it's a little different than influenza in that the incubation period for coronavirus is about 5.5 days right now. Influenza moves much more quickly. And so the good news is we can watch the doubling time is a lot slower with this compared to what happened in 1918. In other words, within a week, hundreds of cases resulted. So we have a little more time when we're watching this happen elsewhere to really prepare ourselves. But the other part to that is we cannot get complacent. And my fear is that after social distancing measures continue to be put into place, we have to make sure they stay the course, even if it doesn't look like the case rates are going up, because it is a little bit slower compared to what we typically see with influenza. So where do we know this is headed? I think that's the big question. How is this going to look? And I answer to that is I wish I knew. You know, I think that at this point we have to take each day as it comes, but you know, the good news is we have a great community that stays prepared. We've been through this together, this group up here, for a while, and we do know how to respond and how to work together. And the last thing is, this is not, you know, a mystery in terms of the virus itself. We know a lot about coronavirus and how it moves from person to person. So we have a lot of science in our hands to know how we're going to beat this together. So again, thank you for being here, and thank you for allowing me to be here.
Thank you, Dr. Carlo. We're getting questions from folks on social media along those lines of how long might the Dallas-Fort Worth area be affected by this virus? And Tanalier from YouTube asks, is it true that warmer weather kills the virus?
So the question is, I think a bigger question is the seasonal change going to impact case rates? And you know, I wish I knew the answer to that question, and I think we don't know. There is some studies that show that viruses don't survive as well in warmer, more humid temperatures, but that's very limited. And as you know, like in Dallas, we all tend to stay in air-conditioned climates in our buildings when it gets hot. So I don't think that there's any science that would tell us that the seasonal change would impact the case rates. But with that being said, if that is the case, My other concern is that once the fall happens again, or if it does slow down over the summertime, are we prepared for another winter? And so I think there's both good and bad with seasonal changes, but again, the science doesn't tell us what's true and what's not.
So at this point, we can't say for certain that we may see a slowdown and then a potential uptick again of infection.
I think that there's a couple of things. One is summertime, as far as social distancing, our schools are out. And we know that that's a place where the most socially dense environment for people in our community is. So it may be when school gets out that it will lower the rates because there's less people coming into contact with one another. But again, that when classes resume, we have to be ready to see what happens after that. But again, a lot of this is around influenza, and we don't know if coronavirus is going to act the same way as influenza.
Well, Dr. Carlo, you were front and center when Dallas responded to other outbreaks and pandemics like the swine flu. How did those other infectious diseases compare to COVID-19?
Well, every single one of our experiences with emerging infectious diseases has been different. And I would say that everything has its own set of parameters. There's certainly some experiences that we've learned along the way. We definitely have learned a lot in how to prepare and how to get the word out and how to communicate. I do think that this is a much, much different situation, and we have to understand that every infectious disease behaves a little differently. But the good news is we have had a lot of experience that gives us a lot of tools that can be useful in a general way.
One last question from social media before we move on. Dave asks, is going out to eat or eating fast food dangerous?
Well, it is an interesting question around food in general. What about restaurants and things like that? I think that my message at this point would be to make sure you're just being wary of your surroundings. And so, for example, if you can go out to a restaurant and stay 6 feet away from one another, that might work. You do want to make sure you're doing the proper hand washing. It's always a good idea before eating any meal, and doing it more than once, it makes a lot of sense. As far as food itself, there's no evidence that shows that coronavirus would be transmitted by food or any type of situation like that. But again, you have to be aware of your surroundings at all times. And I think the bigger issue around restaurants is making sure you're avoiding crowds and washing your hands.
So for folks who want to support their local businesses, would perhaps getting your food to go be a good option?
It certainly is an option. I think, again, my advice would be as long as you can stay 6 feet away from one another and wash your hands, I think we can do things that are practical. I think we are going to be at an extended duration for this, so we want to make sure we're preparing for a longer experience rather than just a short period of time. So those types of things may be reasonable things to do.
Thank you, Dr. Carlo. And with that, we will turn it over to Jennifer Finley with Dallas ISD.
Well, thank you again to the Perot Museum for being here and just the privilege of being able to, thank you, being amongst these, our fine panelists. So as soon as Dr. Wong had pointed out and as Dr. Carlo had pointed out, the school district has been involved in different, I remember I was working with the school district back when we had swine flu and Ebola, and although they acted different or behaved differently, we still were able to glean from some of those experiences as part of our planning process. So as soon as we began watching the news and there was more and more talk about the possibility of it coming into the United States, and then seeing what was happening in Seattle and how the schools were being affected there, we, if you will, kicked it into another gear, and our leadership staff started meeting again, what if, and discussing, the possibility of school closure. Of course, we don't want to close our schools. We're there to serve our students. And then, and just making sure that we were prepared. Distance learning, that's not something that we've had to do. Our students come into our buildings. So just looking at those lenses of how we would do that, how we would do food distribution and still provide services to our students.
I think that's an important question on a lot of families' minds. As we know, so many children rely on the meals that are provided through the schools. And DISD has said that it will continue providing meals to students even if the schools do close.
Yes.
Could you walk us through exactly how you would do that while still managing the risk of transmission in the community?
So we normally distribute meals over, like, say, our summer break. And right now, actually, we are distributing meals for spring break. It's a little bit differently. We're doing a little bit differently this year, though. We have 20 sites that are strategically located in the community and that we can distribute. We've moved to a grab and go. Normally, when we were in, the midst of a pandemic, the students would come in, they'd get their breakfast and or their lunch. We'd have some kind of an activity for them, some type of an enrichment activity. We have canceled that, or that has been forgone. Oh, okay. We've canceled that, so we've gone to a grab and go method to where everything is packed in a sack. The student takes it with them, goes back home, and then they can of course come back for lunch as well if they choose.
We know that a lot of parents and families are having difficult conversations with their children right now about changes in their everyday lives, keeping a distance, hand washing, perhaps dealing with canceled plans for spring break travel. Do you have any advice for parents who are having those tough conversations with their children? How can parents effectively talk to kids about the coronavirus pandemic?
And that was one of the things that we were concerned about as well. It just all the attention as this has been in the media, is it going to cause anxiety amongst our students? Of course, it's causing anxiety amongst the parents as well. But so our counselors work together with our to develop guidance lessons, if you will, if students voice that to teachers. Hey, what is all this, talk about? Should I be scared? Should I be nervous for myself or, for my family? So we did develop guidance lessons for to be used in the classroom. And we have also created or made available just different resources through our websites and distributed resources to parents so they can be prepared to answer those tough questions. And just with the emphasis of stay calm, try not to pass that and that anxiety, that fear along to your child, and just be factual, making sure that you've got the good resources to glean from our Dallas County Health Department, our CDC. Just very factual, calm messaging to our students or to their children.
Thank you for that. I want to open up the floor to a few more questions that we are getting from social media, and I'll open it up to all of our panelists to weigh in. Laura from YouTube asks, I'm a pre-diabetic. How concerned should I be about the coronavirus?
Pass that to you.
So one of the questions that we still don't know the answer to is when you look at coronavirus infections, who is going to have a potential more severe illness? And one of the things we've learned from so far in other countries is those that have had mortality, those that have died, have had an increased rate of certain chronic illnesses, which does include diabetes and heart disease and cancer. But with that, these are very, very non-specific, and so we don't have a lot of information, particularly if a pre-diabetic or a well-controlled diabetic would have a more severe case. So there's still a lot of uncertainty around that, unfortunately. It does sort of make things difficult to make good recommendations for individuals. Am I more at risk? But there are some things we do know. One is age does play into a risk factor. So, depending on if you're 60 to 70 or older than 70, we know that those likelihood of severe infections go up with each of those age ranges. But as far as chronic illnesses, that's a question we're still trying to learn.
And we've heard that several times that folks with certain pre-existing conditions are at a higher risk. Can you tell us more specifically which of those pre-existing conditions are of a concern?
You know, again, I think that this is a good question, and particularly for individuals, that if there are concerns, it's a good question to your own physician or your own healthcare provider to provide that recommendation. You know, again, healthcare is a science, and there's never perfect. Nothing is perfect in science, and so one of the things you want to make sure is, you know, that making sure you're following the guidance of your healthcare providers first. Again, we don't know if there's any catalog or official way to predict severe infection based on any pre-existing illness at this time. Certainly there are some things such as diabetes or something that would impact your immune system would likely put you at a higher risk. But again, we don't have absolute certainty with that yet.
Right. A question from YouTube. This comes from Andrew. And Jennifer, perhaps you can help us out with this one. Andrew asks, what is the significance of closing schools for 2 weeks or potentially longer?
That's a loaded question. Of course, there's the ramifications to the families as far as like daycare goes, or just the educational loss, of course. So all those, in thinking through that, you have to, as we were planning in preparation of the what if, you had to think through all of those things, the food distribution to students, just different ways how we could do that. So.
Thank you. And another question that's being posed in the community, a lot of folks wondering if it is safe to go to the gym during this period. Dr. Carlo, you talked about sweat not being one of those respiratory fluids that is a greater concern, but are gyms a safe space for folks to visit?
Well, that's a great question. I think that, gyms, there is a risk about is, of course, you are congregating with other people and have a high degree of common touch areas and common touched equipment and things like that. So there definitely is some, I think, wariness to be aware of, watchful of your surroundings. I would look at this very carefully with my own situation, particularly if, I know I'd be at higher risk, perhaps if I'm over the age of 60 or 70, maybe I would have a different conditional question around whether I would go to the gym or not, or if I have a chronic medical condition that might put me at higher risk, I might make a different decision on that. I know that gyms do a lot to try to keep the environment clean. Depending on how many people are in the gym, that may or may not be possible. So it is a tough question. I think you'd have to evaluate your own risk and then evaluate whether or not you think that the gym is a safe environment based on what you know in terms of how well they clean and how many people are in there and things like that.
Right, so doing an individual risk assessment may be the best way to make those decisions.
Yep.
Okay. Well, we are getting close to our time, but I'd like to open the floor to each of our panelists to share any closing remarks that you have with our listeners, starting with Mr. Lowe.
Yeah, just to reiterate, please don't panic. Please realize we're all in this together. It truly is a cooperative effort. I'll give you a great example. You could have a person who is a presumptive positive and they're tested and found in Dallas County, but maybe they live in Tarrant County. So then Dallas County has to coordinate with Tarrant County when they do tracing and those kinds of things. And all of us have a responsibility to strive to comply with what the public officials have asked us, whether it be crowd size, practicing good health habits. We'll get through this. We will definitely get through this. It may get a little worse before it gets better, but if we all work together and cooperate, things are going to turn out okay.
Well, thank you for having me here. I think that what I would leave everybody with is how will this play out? I wish I knew the answer to that question, but I will say that this is not on its own something that has happened for the first time. And, human beings have been involved with fighting infectious diseases since the beginning of time, and this one is no different than what we've seen in the past. I think that we have experience, but I just want to share some other numbers in passing. Just in terms of mortality rates with other infectious diseases, Ebola, 70% mortality. Smallpox, which is an ancient virus which we no longer have, 17% mortality. The Spanish flu in 1918 was a 3% mortality. SARS in 2003 was a 10% mortality. Right now, we don't know what the mortality of coronavirus is, but we think it's somewhere between 2 to 3%. We think it's going to go lower, potentially as more people become sick, or we're actually able to count more that are showing asymptomatic illness. But the other thing is, how infectious is coronavirus to others? One of the more infectious viruses we know, measles. Measles has a doubling rate, which means every case of measles potentially spreads to 12 to 18 people. That's a good reason why you should get your vaccine. Smallpox was 5 to 7 people for every one case. HIV, it was 2 to 4. Right now, coronavirus is about 1.4 to 5.5, a pretty big range. We want it to be on the lower end, but again, it shows you kind of where this fits in with all of our other infectious diseases that we continuously fight against. I think at the end of the day, the virus itself is going to be a part with us. It's going to make its own changes, and so will we. And it's up to us to make those right changes in order to limit the number of people who become infected and limit the number of people who are going to die. Thank you.
And just for our parents, please continue to monitor our website. We're posting messaging even throughout the break daily to parents, just to let them know just updates and the possibility of closure. Like I said, our goal is to keep the kiddos in school. It's to come back from the return of spring break, but we will be monitoring that. And to continue to message those clear, calm messages to your children as far as covering your cough, washing your hands, to keep them well and to keep them safe. And thank you again to the Perot Museum for the invitation. Most appreciated.
Thank you so much to all of our panelists. Thank you, Dr. Wong, for being so generous with his time today. And thank you once again to the Perot Museum for hosting this discussion. To all of our viewers on the live stream, thank you for following along. We hope you've learned some valuable information here today, and we look forward to continuing to share and share these insights as this outbreak evolves. And don't forget to wash your hands. Thank you all so much for your time.